content, we'll be going over your report dashboard, which is going to show you how to set up your provider default reports and how to set up recurring reports. And then we'll jump on into the core and menu set objectives for Stage 2 meaningful use. Next week, we'll begin our CQM webinars that will cover the content for each individual CQM. Okay? We will have the opportunity to answer questions at the end of today's webinar session. There's a question tool built into the webinar. So at the end, you'll have an opportunity to type in your questions, and I'll answer them one at a time. I do ask that your questions be relevant to the content that's being covered today to make sure that everybody reaps the most benefit from the questions being asked. I've been told there's lots of static on this phone line. This is a number being hosted by GoToWebinar. I ask that everybody puts their phone on mute. That can cause static. If you continue to hear a lot of static, I ask that you go ahead and exit the call and try dialing in again to see if that will help it. Again, we're not hosting this number, so I don't have control over the call quality you might hear. Okay. So to start, we're going to go ahead and pull up our Stage 2 Auto Measures report. This is the report that covers all the criteria in the core and menu set measures. And you'll notice here that there's a separate dashboard report for the clinical quality measures. So today we're going to cover the criteria that's included in the Stage 2 Auto Measures report. You'll also notice that there are links that you can set up under your preferences for each one of these reports. You just simply click on the link and it will take you straight here, so you don't have to click under the reports menu to select them. Okay? To set up provider default reporting, you would select the provider defaults radio button and then select the appropriate provider from the left-hand side. Okay? And the reason for this is that some of these measures do have exclusions built into them based on your practice and your specialty. Some of the information may not be relevant to your practice. You may qualify for an exclusion. If that is the case, you can just simply omit it from being included as a default report, which will then be run every month or every day or every week, however often you set up the recurring report. Okay? So to set your defaults, you just select the reports that you want to include. Some of these reports, you'll notice, are not necessarily criteria that's tracked in ClinicsMD for reports. You do not have to include those. We've put them into the report so that you can select yes or no as part of your attestation response and have that response displayed on the printed report that you'll use before you attest. Okay? And then just F5 on your keyboard or the refresh icon to save your report. Okay? The next thing is the option to set recurring report schedules. This will allow you to set up a report run as frequently as you need so that you can come straight into the report and view the results on a more timely basis. You don't have to sit here and wait for the report to run for you. To add a recurring report schedule, you'll select the Recurring Reports radio button, then click the Add button. Okay? You'll then select the time period. There's certain defaults built in that you can select from, either year-to-date, past 30 days, past 90 days, or set a specific date range for your report run. You then select the frequency. You can choose to set it to run daily, weekly, or monthly. Okay? To do it daily, you would mark the appropriate days. you want it to run every day of the week, mark the All checkbox. If you want it to run only certain days of the week, set those specific days. And if you want it to just run weekly, obviously you would just select one day of the week. To do a monthly report run, select the monthly radio button under frequency, and then indicate the date that you would like it to run. You have a couple of defaults available here, either the first day of the month or the last day, or you can set the specific day of the month. And what this does will set up your recurring report run so that it automatically runs the report for you. Upon completion of the report run, you will get a notification in your system messages that you have a brand new report to go view. To view your report dashboard, you'll go back to Reports/Results. And it will show you the results for each report run that has not been archived. Okay? It'll show you the date range, your run option, either ASAP, meaning an immediate report run, overnight, or if it's recurring, it will indicate recurring. Run status indicates if it's been completed or if it's pending or in process. The date it was run and by the user, and the status of the report. You'll notice that there's 3 color statuses that everybody should be familiar with. Red means you missed the target on one or more reports. Yellow indicates that the report has not been completed yet. And green indicates that your target percentage, meaning the minimum required percentage for each measure, has been met. Okay? So at a quick glance, you'll know where you are for the reports that have been selected. For this one, for example, it says green because target's met. This one would indicate that the status hasn't been met on one or more reports. If you would like to just quickly rerun any of the report runs that you have already in here that have not been archived, which you can do so just by marking the Archive checkbox at the far right, is to just click Edit Reset. By default, it's going to include the date range and your selected reports from the last report run. This is just a quick way for you to rerun the report and get immediate results. You'll notice that there is a run frequency column here, ASAP meaning as quickly as possible, or you can select it to run overnight if it's not as urgent a need. And that way you'll get it will run overnight, you'll get a message and have it waiting for you the next business day. Okay? And just click OK to rerun the report. Another feature built into these meaningful use reports is the ability to save your details. And what that does will save the information and the patient detail related to each measure on our server. Each provider is allowed to have one detailed report saved. We recommend that you do this for that last report run prior to attestation. That will also be the report that you print out to have in your hard copy of your records. To save it, you would just simply click the Save Details button. As you can see here, this last report that I just processed went from a pending status to completed. Excuse me. And the run date has been updated to 8/26. You'll notice that there is a set of icons to the far right of each measure. For the header, which is the description of the measure, if you click this magnifying glass icon, it will tell you the measure and criteria being tracked by the report. For each measure, for example, for CPOE, for medication, laboratory, and radiology orders, you'll notice to each specific criteria being tracked, there is a magnifying icon. Click the icon, and you can view the specific patient detail in the numerator, denominator, and non-qualified. Non-qualified lists the patients or those that are in the denominator but are not in the numerator. Select the denominator, and it will display the patients that qualify for the denominator and numerator. For this example, your denominator and numerator are both 1, so there's no patients in the non-qualified list. There is an account number search box here, so if you're looking in a large amount of criteria or a large report time that results in a large amount of data, if you're looking for a specific patient to check if they're in the numerator or denominator, you can search for them by account number. If you need to export this list, click the Save As button, and then you can export the list in an Excel spreadsheet. Select the Save As type as Excel with headers. Set your file name and the location in which you want to save the report. Okay. And that patient search feature is available for each measure. For this measure, we'll see that the denominator has 1 patient in it, 0 in the numerator, and that 1 non-qualified patient is in the denominator but not in the numerator. Okay. So that covers our Stage 2 automated dashboard report. Now we're going to move on to the core and menu set criteria. We're going to cover today, A, the criteria that's in the measure, and B, how it's tracked in ClinicsMD. The first measure is CPOE, which stands for Computerized Provider Order Entry for medication, laboratory, and radiology orders, entered directly by any licensed healthcare professional or provider. In ClinicsMD, any medication entered into the system is considered entered by CPOE. There's not a way to indicate that orders were ordered otherwise. To track this information, you'll continue to use the Order Entry tab to order your labs and radiology orders. You can still search by either your in-house orders, for anybody that's not familiar with that capability, or your vendor-specific orders. So you can order both types from the same screen, and they're designated by type. Your medication orders will be continued to be ordered in the Prescription tab, as they always have been. This is considered your medication order. Okay? Pretty straightforward. Moving on, the next measure is ePrescribing your permissible prescriptions, which are defined as non-controlled substances that are being sent via ePrescribe. Second part of that measure is written by the eligible professional who has queried the drug formulary and transmitted electronically. ClinicsMD, the drug formulary is automatically enabled and will provide the information on screen when that information is being supplied by the patient's formulary benefit manager. Okay, so that's automatically built into ClinicsMD. And to send prescriptions electronically, you would click the Send button, select the pharmacy that you want to send to. ePrescribing pharmacies will have this E designation, and click Send. It will then update the status to ePrescribe. So again, the denominator for that measure is the number of prescriptions written for drugs. So each individual drug is counted in the denominator. The numerator is the total that out of the denominator that have been sent electronically via ePrescribe. And your threshold percentage is more than 50% of all permissible prescriptions, which are defined as those drugs that are not controlled substances. The next measure is a carryover as well from stage 1, and it's recording demographics in ClinicsMD. The majority of our clients use a practice management system to document this information, and it comes over the interface electronically and sets it in ClinicsMD. Therefore, there's no additional work for you to do. But to verify, you want to make sure that at minimum you have the patient's sex, race, ethnicity, date of birth, and preferred language recorded. Okay? Date of birth recorded here in this field. Primary race, ethnicity, and preferred language. You'll also notice that an additional races column was added as part of stage 2 for your patients that claim multiple races. And the threshold for that requirement is recording this information in ClinicsMD for more than 80% of all unique patients during the report period. Moving on, the next measure is, again, another carryover from stage 1. It's recording vital signs in ClinicsMD, and at minimum, it's defined as blood pressure for all patients ages 3 and over, height or length, and weight. Those two criteria have no age limit. To record vital signs in ClinicsMD, nothing has changed. You select the Vital Signs tab and record your systolic and diastolic blood pressures and height and weight. There's some exclusions available in 2014 that were not previously available, in which any provider that sees no patients 3 years and older is excluded from recording blood pressure. Any provider who believes that all 3 vital signs of height, length, and weight and blood pressure have no relevance to their scope of practice, believes that height and weight are relevant to the scope of practice, but blood pressure is not, is excluded from having to record blood pressure. And finally, believes that blood pressure is relevant to the scope of their practice, but height and weight are not, is excluding height and weight. You have the ability to identify your preferred vital settings for each provider in your practice in Account Maintenance in the User tab. So select the provider name, and they'll be identified here by the license class. And then in the lower pane of the screen in the Options tab, there is a setting in which you can choose what vitals you will be collecting in your practice per provider. Height, weight, and blood pressure, height and weight only, or blood pressure only. Based on the settings that you select for each provider, the Auto Measures report will then calculate the report based on the data being entered into ClinicsMD. The threshold for this is 80% of all unique patients seen by the eligible professional within the report period. Again, it's expected for patients 3 and over, you record blood pressure and height and weight for all patients, unless one of these exclusions apply to you. The next measure we'll be reviewing is the recording of smoking status. This is another carryover from stage 1, in which you're recording the patient's smoking history in the Medical History tab in ClinicsMD. The threshold for this measure is more than 80% of all unique patients aged 13 years and older. Okay? To indicate that you've discussed the smoking history with the patient, simply mark the Discuss Smoking History with Patient checkbox, and then to indicate the current smoking status. If you've tracked this information in the past, the previous smoking history will be displayed on screen. Both the status and the date will be displayed. If the patient is a smoker, indicate the smoking status. In addition to the original entries from stage 1, which indicated current everyday smoker or someday smoker, additional entries have been added to indicate if the patient is a light or heavy tobacco smoker. If you select an appropriate smoking status, indicate the type of tobacco smoked and the relevant cessation recommendation provided to the patient. In addition to the clinic-defined responses that were available in stage 1, there are a set list of responses that have been added as well. Any of the responses are acceptable and have been mapped to an appropriate SNOMED code for your reporting needs. The next measure is, again, another carryover from stage 1 with a slight modification. For stage 2, you must implement 5 clinical decision support interventions related to 4 or more clinical quality measures. Absent 4 quality measures that are relevant to your scope of practice, the clinical decision support interventions must be related to high priority health conditions. Okay? We went over how to set up your decision support rules during last week's webinar sessions, and we will be publishing those and putting them under the training link in ClinicsMD shortly. So you can go back and review how to set up those clinical decision support interventions and how to use them in your practice. This is a yes or no attestation question. So not related to a specific threshold in ClinicsMD. When the decision support rule fires or triggers for a patient, you will receive a pop-up window on screen indicating that the patient qualifies for specific clinical decision support information. The date it triggered, the intervention name, and information on what is tracked in that decision support rule and why the patient qualified for it will be displayed in the information column. For example, for the screening for diabetes with A1C results, decision support intervention, the intervention rule is set up to look for patients with an A1C score not between 4.5 and 6. This patient has a most recent recorded A1C score of 3, which caused the intervention to trigger. If you, for some reason, inadvertently acknowledge a rule that you shouldn't have and you would like to reset it, you can select the Reset Rule button. It will ask you if it's okay to reset it. And that rule has now been removed from the patient's history. Examples of this may be occurring if your decision support intervention is based on a specific gender and your patient was inadvertently entered with the incorrect gender. Let's say you have a male patient that was entered into ClinicalMD as a female patient inadvertently, which then triggered a specific decision support rule for female patients. You would obviously not want that data listed in the patient's chart. So you can select it and click Reset the Rule, and it will remove it from the patient's history. Okay? And say you want to see the rule fire live for your patient. We'll select here the A1C score, which was in that previous rule. We'll enter a result of 8. And in this case, I forced it to fire for the patient, but when you're selecting the patient, the rule would then automatically display on screen. Another feature that's been added is the Show All button. By default, it's going to show you the most recent non-acknowledged support intervention. But if you'd like to go back and review all of them for a patient, just click the Show All button. You can toggle back to your Show Unacknowledged. Okay? Now you can either set that the alert has been acknowledged and then separately select Apply Intervention. But a new feature that was added is the ability to do both at the same time. So go ahead and acknowledge and apply intervention. Okay? Click that button. And the applicable interventions associated with this decision support intervention rule will be displayed in this window, and the affected tabs will be displayed in red. This is to get your attention to let you know that there's information in each for you to review. In this case, it's information that can be used in practice. In this case, it's reminding you to provide patient education. Select the Education tab, and you can apply this to the patient's encounter so it can be printed out and given to them. And then finally, in this case, is the bibliographic reference citation that has been made available to the providers to review when this information is displayed for a patient. Okay. Click Close, and this intervention has now been acknowledged. Our next measure is providing patients electronic access, which is defined as the ability to view online, download, and transmit their health information within 4 business days of the information becoming available to the eligible professional. The minimum threshold for this measure has been increased from 10% with the original Stage 1 requirements to more than 50% of your patients. This is a carryover from Stage 1, so most people have already started giving their patients access to the patient portal. But because of the increased threshold for this, you're going to have to start giving it, obviously, to more patients seen. Again, the threshold is more than 50% of all unique patients seen during the report period. So to review how to enable it for your patients, go to their patient information area. And in the Demographics tab, you'll see the Patient Portal section. And just simply mark the Access Enabled checkbox. Will then be prompted to tell you, or it will give you a prompt to tell you what information you are providing with the patient, and then click Yes. In this case, my user is set up to select the printer before each print, so I have the option to select different printers. However, if yours is set either to a specific EMR printer or just to use your Windows default printer, this piece of paper, which is the registration instructions to get to the patient, will automatically print out without that window populating. Okay. So I'm going to go ahead and print this up and show it on screen. And here are the instructions that we'll print out to give to your patient. It gives them a brief overview of the information that is now available in the patient portal. With their registration PIN. And then instructions for registering are down below. Okay. The clinic location name will also be displayed on these instructions. Hand those to the patient, and they can go ahead and sign up for the patient portal. If they lose that PIN number, that registration, for whatever reason, either originally when you were first giving them access and they chose to just throw it away and not pay any attention to it, or if they contact you now again saying you just gave it to me the other day and I've misplaced it, you can reprint that original registration for the patient now just by clicking this reprint button. Prior to this, you would have to remove their access and then re-enable it. Now you can just click the reprint button. Okay. You'll notice some additional information that's displayed on screen. You'll now see when that patient portal access was first enabled for the patient. If it's been disabled, that information will be displayed on screen as well. And then also the patient's last login to the portal will be displayed as well. And this information was added to help you encourage your patients to log in and view their information. There is a corresponding relative of this measure, which I'll be covering in a few moments, called secure electronic messaging, in which you send messages to the patient portal and receive messages from the patient portal from patients for at least 5% of your unique patients seen within the report period. So by you looking at this information and encouraging them to log in and send you messages, it will help both meet this measure as well as meeting the corresponding sending secure messages measure, which we'll be covering momentarily. Going hand in hand with that is a report that has always been available in ClinicsMD, but has a bit more information in it, is the demographic report. This will help you track patients that perhaps have had access enabled to the portal but never logged in. So you can set either a specific time period to capture patients or just look for any patients that have had the access enabled but never logged in. So you can better manage those and perhaps use it for follow-up of your patients. So this is a list of patients that we've enabled in our test patient portal server. And the far right column indicates that they have never logged into it. So again, another tool to help you manage those patients and to work with them and encourage them to log in and at minimum view their information online and start sending you secure messages, again, for more than 5% of all unique patients seen during a report period. It's a very low number starting out for stage 2. It's only 5%. Should be relatively easy for people to meet that measure. I know there's going to be a challenge for our providers that are in rural health care areas in which their patients are not using or even interested in the patient portal. CMS has addressed that concern, which has been brought up many times by saying get creative, perhaps have somebody, a designated person in your office with a tablet, help patients right then and there log in and register for their portal as one way of helping them log in and meet that measure. There are exclusions available for this measure. Providers that conduct 50% or more of your patient encounters in a county, in a region that doesn't have at least 50% of its housing units with at least minimum 3 megabyte per second broadband availability, according to the latest info by the FCC on the first day of your report period, may exclude that second measure. Okay? Now briefly, I'll go ahead and bring up the patient portal. Okay. Your patients will log in, and they'll see the following information. By default, what's displayed is their overall health summary. Clinical summaries that you send to the patient portal are available under the Clinical Summary tab and sorted by date. Messages that you send to the patient are available in their message center. By default, it displays the inbox, but you can also view the sent messages they sent, and then compose new messages. There is a share your information feature, which allows them to send their information electronically to other providers using a direct address message. We covered that last week. Direct messaging is a functionality built into ClinicsMD where you can use a unique, secure, encrypted emailing format through the Direct project facilitated by SureScripts in ClinicsMD. and that information from other providers will come straight to the clinician in ClinicsMD into their messages area in ClinicsMD. Same holds true for patients being able to send it from the patient portal. They can call a provider and ask for their direct email address and then mail them, or email them rather, securely in an encrypted format their health information, which is their overall health summary that's made available and published in the patient portal. Okay? They also have the ability to download and print their information, and it's going to download two files. It's going to download a CDA file, which stands for Clinical Document Architecture. It's just a specified format that other certified electronic medical record systems can electronically read in order to reconcile health information into their system electronically. It's also going to download a human-readable format for the patient to view and print out. The three options available are download an unprotected zip file, download a password-protected zip file, or download an encrypted zip file with a password. Okay? There's also, of course, the printer-friendly version that's available. Then there's also the usage history, which just logs the patient's access into the patient portal and their activity. Okay? We're in the process of making some changes right now to the patient portal to make it more user-friendly. We are rolling out web accessibility pages. To make it easier for people to view their information online and just use their keyboard to tab through the information rather than being dependent on the mouse. Okay? If your patients need to change any of their information, the main repository for everything is ClinicsMD. The patient portal just displays that information. So if there's anything critical that's incorrect, their name, their date of birth, perhaps an address, a medication, etc., patients will be instructed to contact their provider to update this information. If they somehow get a hold of our support, which we do have links to support if they have any questions, we direct them to their doctor's office. The information they can change is just limited to username, password, email address, and then their security questions. So again, if you ever get a phone call stating information is incorrect in their patient portal, it's because they're being directed to you from us. Okay. Moving back to ClinicsMD. The next measure is providing patients with clinical summaries within one business day for more than 50% of office visits. This is a bit different than some of the other measures we've discussed so far today, in which they specifically track unique patients seen during the report period. This measure covers patients that have had an office visit. So rather than it being limited to just unique patients, it's all office visits. So if the patient has been seen 6 times during a report period, all 6 visits will be included in the denominator for this measure, versus the other measures in which it's a unique patient, in which they would only show up in the denominator one time. Okay? So let's pull up the patient we've been working with and review how to send or provide a clinical summary. The definition per CMS of a clinical summary is very comprehensive. Now, it does state that you can voluntarily exclude information in which you feel would cause more harm than good. But they encourage you to provide, at minimum, patient's name, provider's name and office contact information, date and location of the visit, reason for the office visit, the current problem list, current medication list, current medication allergy list, any procedures performed during the visit, any immunizations or medications administered during the visit, vital signs taken during the visit or the most recent vital signs recorded, lab test results, list of pending diagnostic tests, clinical instructions to include a care plan with goals and instructions, future appointments, referrals to other providers, future scheduled tests, their demographic information, which was covered in the demographic measure, to at minimum include sex, race, ethnicity, date of birth, and preferred language, patient smoking status, and recommended patient decision aids. Okay? So at minimum, that's how CMS is defining a clinical summary. Again, you can customize what is in that and also have the ability to withhold certain information that you deem not relevant or would cause more harm than good. Okay? To generate a clinical summary in ClinicsMD, select the Progress Note tab and then click the Clinical Summary button. This has been available since our original Stage 1 release. Some new features include the option to indicate that the patient declined this clinical summary. Indicating as such will include the patient in the numerator for this measure. In other words, you'll get credit to the clinical summary measure by indicating that a patient declined it. Click the Show History button if you want to review the history of clinical summaries provided to the patient and how it was provided to them. Okay? And finally, click the Generate Clinical Summary button to generate a clinical summary to provide to the patient. In the system default that we provide, everything is included. Everything meaning the sections of the clinical summary, which we just reviewed, are automatically marked to be included in your clinical summary. You can also set up default clinical summary profiles for the location and specific providers, which allows you to customize specific clinical summary formats depending on the provider and your clinic and even type of visit. Okay? If any of the information you don't want excluded at that time of the visit for that specific patient, just uncheck the Include checkbox. And that section will be excluded from the clinical summary. Okay? If it's such as the patient's problem list, and there's only one or two diagnoses you don't want to be included, just please select specific problems, specific medications, etc. You'll notice that there are notes fields available for you to enter additional information as needed. Okay. Anywhere that there is a note field available, you can enter text. Say, for example, for a specific lab result, you want to add further explanation, you can do so by just putting your cursor in the notes field and entering text. Okay. We have a few options available now to give this to the patient. You can click the Print button to print out a hard copy. Click the Export button to export both the CDA and a human readable format. Doing so will prompt you to password protect the file. So you can send it via other means like a USB flash drive, burn onto a CD-ROM, perhaps send it through your secure email. If you do this method, especially using email, I would prompt the patient to to contact you for the password directly rather than including it in that email. And then finally, there's the option to send it to the patient portal. If for some reason the patient's preferred method is fax, you can also send it via fax. Okay? And once done, it'll update and indicate that you provided it via the patient portal. Now, again, this measure has changed slightly from stage 1, in which the measure now is from 3 business days down to 1 business day that you must provide the clinical summary. Let's say, for example, you meant to give it within a certain date and you forgot to do so, or you were wanting to include lab results, but it took a day or 2 to get the lab results from the lab entered into ClinicSMD. If that is the case, you can modify the date in this date field. The encounter date is listed here. You can change it here to make sure you're within that 1 business day threshold to accommodate those situations in which you have delayed the clinical summary to make sure that all the required information is documented. Okay? Again, this threshold has increased from stage 1, and you must include it for more than 50% of office visits, meaning your target threshold has to be greater than 50%, even if it's 50.5%. Okay? 50% on the nose will not suffice. The next measure is, again, another carryover from stage 1. It's still a core measure. It's protecting electronic health information created or maintained by the certified EHR. This is a function outside of ClinicSMD and anything you would track in ClinicSMD. It's instructing you to conduct or review a security risk analysis in accordance to the requirements set forth by the HIPAA security rule, which covers administrative, physical, and technical safeguards in your office to make sure you're maintaining electronic PHI. Physical safeguards would include, do you have an alarm on your building? Do you have locks in your building? Administrative safeguards would be ensuring that people have unique passwords, they're not sharing those passwords, making sure that screens that are displaying electronic PHI in ClinicSMD cannot be viewed by passerbys so that patients' information can be seen. Either have those screens put on your computer screen so people can't see it from side views, or turning your screen so other people can't see it. Technical safeguards would be including making sure people are changing their password, having a stated password length requirement in your office, automatic log out of ClinicSMD, automatic screen lock in ClinicSMD after a certain time, which automatically closes your screen so patient information cannot be reviewed. Again, this is not a function or a report in ClinicSMD. This is something that you have to do within your 90 days. CMS and healthit.gov has provided information on this and kind of guidance on how to conduct one. I will be sending out those links after today's webinar to everybody. One of them is the security risk assessment tool that the ONC and healthit.gov have come together and formed for you. You can either run the tool on your computer or download the Word documents that go along with it. And it goes over the criteria covered in each of those categories, which are administrative safeguards, technical safeguards, and physical safeguards. And to answer a question that's gone ahead and popped up now, no, you do not have to include information about the server that we maintain at our data center. If you were hosting the server ClinicSMD on your own local server, you would have to include information on that, on how you're protecting servers. But for the most part, the majority of our practice is access their information through the internet into our data center. Okay, so this is you protecting ePHI at a local level. For our clients that do host it locally, you would have to include information about how you are securing your server that hosts ClinicSMD in your report. And again, this is very overwhelming, and I know that, so I will be producing links on it. Again, they have a security risk assessment tool that they've provided this year that wasn't previously available, and also a kind of FYI on how to protect health information and how to conduct a security risk analysis. So I'll be providing links for both of those to everyone after today's call. Okay. That must be done during the report period. Using one from a previous year will not suffice to meet this measure. You have to have a current one on file. Moving on. A measure that is a carryover from stage 1 and has actually been moved from a menu set to a core measure is incorporating lab test results in a structured format in ClinicSMD for more than 55% of all clinical lab tests ordered in ClinicSMD. Okay. Lab tests, as we reviewed earlier in the CPOE measure, are ordered through the Order Entry tab, and the results are stored in the Labs tab. Now, you can order labs directly in the Labs tab. The Order tab was just added to facilitate the ordering of all types of orders in your practice in one area. For example, radiology, labs, immunizations, and injections given in the office, and even procedures. So you can do it all in one area rather than coming tab to tab to tab to do the ordering of each information. So it facilitates the process and you putting in all those different types of orders just in one location versus going to the Labs tab to order the lab, going to the Radiology tab to order the radiology order, going to the Procedure tab to order the procedures, and so on and so forth. Okay? The results are then just recorded in a separate area so that they can be quickly identified and reviewed. Okay. As I showed you earlier, this is where the individual lab orders are recorded, and this is where the results are entered in ClinicSMD. If it comes across the interface, this checkbox is marked. You do not have to have an interface, a lab result interface, to meet this measure. However, it does help you meet the measure in a more efficient process because the labs are coming over automatically and showing up in ClinicSMD. If not, you will have to manually enter the results in ClinicSMD by entering the result here in either a numeric format or positive and negative format. Any lab that's marked as completed without a result will put the patient in the non-qualified list, which means that they're in the denominator but not the numerator for this measure. The threshold for that is more than 55% of all clinical lab tests ordered in ClinicSMD. Again, this measure isn't just focusing on unique patients, it's reviewing each individual order. If a patient has 6 orders in a specific encounter during the report period, all 6 orders are included in the denominator. Okay, moving on. The next measure is a yes or no attestation question. It's not a measure that's tracked per se by the Stage 2 Meaningful Use Auto Measures report in ClinicSMD. It's a separate report that you need to run. When you go to a test, you just select yes or no. This is a core measure, so you do have to at least one run report for this measure. There are no available exclusions. Okay. The requirement for this has not changed. You still run the applicable patient list report. It does state that you must generate a report based on one condition with a specific condition. So during the report period, the previous patient list that you have generated outside of the report period will not qualify for this year's meaningful use. And the date is included when you print that report. Okay? Select the patient list report. First, select your date range. Then select at minimum your contractor provider on the account, so your eligible professional. Then click the Add Criteria button to get straight to the problems. You'll then be prompted to do your ICD search. Select your problem or problems. You'll notice there's some additional search criteria that's been added. This will really become useful if you're looking for patients that don't have a specific diagnosis or do, or if you're searching for multiples that you want. Patient has this diagnosis but doesn't have this one. You want to really narrowly define the patient population that you're wanting to track. Okay? Then click the search button. It's broken out by demographics, problems, and the full comprehensive list, which is just everything, the patient name, the demographic information, and also the problem list. Okay? You can pick and choose what you want to print. If you print all, it's going to print the demographic report, the problem report, and the comprehensive report. If all you want is a single comprehensive report, deselect the all checkbox and just mark comprehensive, and it'll just print the one report. Then click the print button. Any of these reports that are required for meaningful use, please, please, please print them and hold on to them for a minimum of 6 years in case you're ever selected for a post-payment audit. You do have the option of either using the ClinicsMD PDF printer or another installed PDF printer. If you want to save those printed files electronically on your computer, that's fine. The date printed and the date range will be included on that report as well. Just make sure that you do print it during the report period. Okay. The next measure is a carryover again from stage 1. It's now been moved to a core measure, and that's sending patient reminders for preventative and or follow-up care, and to send it on the per patient preference. To briefly reiterate, we covered this last week. You have the ability to set the patient's communication preference in their demographics tab by indicating their specific contact type. You can either send it to patient portal, phone, mail, or email. You can also set up a preferred contact type list in Clinic Setup. That's something we went over last week, if there are additional methods you would like to include. Okay? If you set email, you're going to be prompted to enter an email address on the address tab here for any of those attendees that missed last week. Okay? To track that patient reminders have been given, which was a requirement that was added, let me go back, for stage 2. In stage 1, you could just enter in the report, if you selected that measure as one of your menu set measures, the numerator for the report. The denominator we tracked for you, which was patients 65 and up and 5 and under. And then you entered the numerator because reminders are given outside of ClinicsMD. That was no longer sufficient for certification criteria for stage 2. You had to be a way to track that you gave them to the patient in the system and then automatically calculate it. As a result, we had to add a method for you to track it. There's 2 different places in which you can do so. You can can either record them in the newly added Patient Reminders tab in Patient Information just by clicking Add and then selecting the reminder type given. We've got default types here entered. You can customize these in the corresponding reminder type tab in Clinic Setup. And by default, it pulls in the patient's preferred reminder method. You can change it if necessary. You'll notice that there is a Decline by Patient button. Indicating this will not exclude the patient from the will not include the patient in the numerator. Excuse me. So by you tracking this, it will indicate and insert a record into the denominator for this corresponding report, but will not put the patient in the numerator. The only thing that will qualify for the numerator is an indication that you did indeed give, send, whatever, a reminder to the patient. Okay? You can also track this in an encounter in the Patient Reminders tab. You do not have to record this in an encounter. You can do so. The ability to do so has been added, but if you do not have an open encounter the day you're providing the reminder to the patient, you can just enter the record into the patient information area. In other words, you do not have to open a brand new encounter to indicate a patient reminder was given to the patient. Okay? The threshold for this measure is providing patient reminders for more than 10% of all unique patients who have had 2 or more office visits within the past 24 months. So a very small, narrowly tracked percentage of your patient population. Prior to this, it was all patients 65 and up and 5 and under, whether they'd been seen during the report period or not. This is limiting that measure to a smaller percentage of your patients. Moving on is providing patient-specific education resources for patients. This is, again, another carryover from Stage 1. It's moved from a menu set measure to a core measure. It's still the same 10% threshold that we had before, so more than providing education to your patients for more than 10%. The only difference is now a core measure versus menu set. We have added a feature in ClinicsMD to make this measure easier to track and meet for your patients. You'll notice that in the prescription tab, a new little eye icon has been added. This is your indication that there's education material available based on the patient-specific medication. Click the icon, and you're forwarded to the Medline Plus Connect, which is provided to us by the U.S. National Library of Medicine. Okay? And from here, you can either print it to give to the patient or add it to the message queue. And this will send a link to the patient's messages in the patient portal for them to view. They'll get an indication that they have a new message they need to go view, and it's a link to their education materials on Medline Plus. Okay, just click that button, and it indicates that it was successfully added to the messaging queue. Then click Close. It's also available here in the Diagnosis tab. Again, there's the eye. Click it, and you're connected to the information available on type 2 diabetes. Okay. And then you just click Add to the message queue to send it to the patient's portal. If this is a patient that you have not given access to the patient portal, this button will not be available, and your only option will be to print it. Okay? And click Close. And finally, in the Labs tab, same thing. Anywhere there's an eye, you'll click it. And if you have a corresponding point code associated with the result, which we talked about last week. That information is coming over from your lab vendor. It's automatically stored in ClinicSMD. When there are LOINC codes available for results, it will display information based on that result. Again, either print it or send to the patient if they have access to the patient portal. Okay. For labs specifically, sometimes there are diagnoses that I've really seen this with labs. There's sometimes not always specific information available. It can't do a clean search for you automatically based on that, again, that LOINC code that's associated with the lab result. Order setup in ClinicSMD, and that information is typically coming over from your lab result, your lab vendor. You can do a search once you're in this window, and it will pull up information based on your search. You can then give this specific information to your patient. Okay? Let's say we want to pick the top one. And add to message queue. Okay? And then close. You'll notice here now in the Education tab that any information provided via the Info button is now displayed down here, as is the date it was provided. You can also click Show History to view historical education materials provided to the patient. If you need to go back and review any of it added to the patient's list, just click the corresponding Info button icon. Okay? You can still provide education that's available in ClinicSMD, regardless if it's our education or education you've added to the database. That still counts as well. You can still provide that. We've just made it a bit easier to provide education based on medications, problems, and specific lab results. Okay? Moving on, the next core measure is performing medication reconciliation for patients for more than 50% of transitions of care in which the patient is transferred into the care of the eligible professional, typically from one clinical setting to another, either from another doctor to you as a complete transfer into your practice or even a referral. So if you're a specialist and you receive a patient, a new referral from another doctor's office. Okay? Now you can perform and probably typically do perform medication reconciliation for all patients for the majority of your visits, especially if it's been a great amount of time since the last time you've seen your patients. But this is really specifically tracking those patients that have newly transitioned into your practice from another setting or been referred into your practice from as a specialist. Okay? Now, there's two ways to track this information, or to indicate, rather, that the patient is being transferred into your care. The first method is when you're first creating the patient encounter for that data service. You'll notice a new checkbox has been added on the Create New Encounter window. To simply mark that checkbox to indicate that the patient is either transferring into or referring into your care. Okay? That inserts that patient record into the denominator for that measure. However, if you forget to mark that checkbox when you are creating the encounter, you can then later indicate the patient was transferred in via the Refer/Transfer tab. If you forget, as you can see, it was inserted from me creating that new encounter. If you forgot to do so, this window would be blank. You could then come in here and click the Add button. Okay? And you would select the provider. failed to mention, select the referred in name, radio button to indicate the patient was referred into your practice, or the radio button to indicate the patient was transitioned into your practice. Okay? Either way works. So again, in the Create New Encounter window, mark the Patient Transferred In checkbox, or you can do so via the Refer/Transfer tab. This tab has been given to everybody along with patient reminders, and you'll find it under the Enable tab listed as non-default tabs. Okay. So that's how you indicate that the patient has transitioned into your care. Now, to perform medication reconciliation, all you need to do is indicate the medications by adding them here. Which indicates that there are some medication the patient's already on from another source. It's a pre-existing med. Or if they're on no medications, an indication that no RX is taken. So they're on no medications. Okay? And the threshold for this is performing medication reconciliation, in other words, updating their medication list with new medications for more than 50% of transitions into your care or patients being referred into your practice or your care. Okay. Next core measure is providing summary of care records for patients transitioning to another setting out of your practice. So they're either going to a new doctor completely, they're going to a new care setting, or they're being referred out of your practice to a specialist. Okay. So going back and using that same Refer/Transfer tab, you'll indicate if the patient has been referred out or transferred out. Okay. Select the provider from your external provider list. If for some reason the provider isn't in your list of external providers already, you can manually enter the name here. If that provider has been set up with the direct mail email address in your external provider list, their address will be displayed to the far right. That's going to be your indication that you can electronically send these to another provider. Indicate the type of referral. This is a discrete list. We don't have control over it. This is what the Stage 2 measure is tracking. Okay. And that's how you indicate a transfer or refer out of your practice. Now, to generate a summary of care, click the Summary of Care button. And it's using that same clinical summary window. Mark the Include History button to pull in the patient's full list of all medications, all problems, so both current and historical and problems. So that'll be your resolved problems as well as your active problems. Okay. Previous immunizations, previous lab results, previous injections given, previous procedures, all that information will be included. And then you have some options available. You can send this to the patient if you want to as well. Export it just like providing a clinical summary. You can fax it to an outside recipient. So, for example, let's say the provider you're selecting, you still need to send them the summary of care document, but they are not set up with a direct message address. You can fax it to them. You can also then click Send to Provider. This button will only be available if the provider has a direct message set up for them in ClinicsMD. Click this button, and it will automatically generate and send that summary of care to the provider you selected. Okay? It pulls up the composed clinical information message. It attaches the patient's name. It then also attaches that clinical document architecture file. Again, that's a specific industry-wide electronic file format that can be used to electronically incorporate the patient's information into another electronic medical record system. You can free text the subject. Do not, I stress this, do not include PHI information in the subject line. And then include any additional details in your message. You know, you just want to indicate that this is for a patient that's being referred to the practice, being transferred from your care to another setting, et cetera, et cetera. So text your body of your message here. And then click the Send button. You'll also notice there's this Add Attachment button. You can include other attachments as well, Word files, PDF files, and JPEG files. Okay, then click Send. And then it's indicated down here that the summary of care was electronically provided via clinical information message. There's other options available too that will automatically be tracked depending on what you select. If you printed it, it would select print. If you faxed, it would be displaying fax. If you exported the file, exported CDA would be available. You also can choose email or mail. This inserts the record into the numerator for the summary of care measure. In this measure, there's a couple of different measures that are tracked, total of 3. The first one is providing summary of care records for more than 50% of your transition of care. Okay, that can be any format, exported, faxed, printed, electronically. Second part of this measure is eligible professionals who are transitioning or referring their patients to another setting of care or provider provides the summary of care for more than 10% of these transitions electronically using the certified electronic record technology, so using ClinicSMD. Okay, so again, 50% is your main measure. That's the total of your transitions of care referrals out of your office, so referrals are out. You're providing a summary of care, and that can be done via print, export, fax, electronically. Second measure, of all your summary of cares generated during the report period, 10% must be sent electronically by the method I just showed you, in which you click Send to Provider. That button right here, for those providers you have set up with direct message addresses. Okay. The third measure is conduct one or more successful electronic exchanges of a summary of care document, a part of which number 2 we just covered is a part of number 3, with a recipient who has a different certified EHR technology. This was part of the measure with the stage 1, and if you recall, in which you had to do a test exchange of information electronically with another provider. In that measure, in stage 1, they allowed you to pick somebody that's using the same EHR. Could be a completely separate clinic across the country, and that would suffice. It could still be using ClinicSMD. For stage 2, that will not suffice. You will have to send this message electronically to another provider at least one or more times that is using a different EHR technology. So sending it to a hospital that maybe is using Cerner, or sending it to either a doctor's office that is using eClinicalWorks or NextGen, or one of the other EHR systems, Practice Fusion, et cetera. Okay? As part of number 2, in which you're sending 10% of those electronically, you may use providers that are using ClinicSMD and using the direct messaging available in ClinicSMD, or any other certified system or HISP. such as medicity, okay? For number 3, the third part of that measure, one of those tests has to be with an external system, a different EHR technology. So between ClinicsMD and a provider using NextGen. If you are having trouble locating a provider with a direct message that is not using a distinct and separate EHR technology, they have provided a tool called the EHR Randomizer, in which you sign up to use this tool, and they will set you up with a test EHR to submit your electronic record to. So for Summaries and for measure number 2 of this measure, everyone that you're sending to is using the exact same technology, for example, ClinicsMD. And you're having trouble meeting the third part of this measure, in which you send it externally to a different EHR, you can use this EHR Randomizer tool, and they will connect you with one of their test EHR systems. Okay? This tool was an effort between the ONC and the NIST, which is the National Institute of Standards and Technology. Okay? In those links I'll be sending out after today's webinar session, I will include information and links on this EHR Randomizer application that they've developed to help you meet the third part of this objective. Okay? Moving on. The last two core measures. The first one is, again, another carryover from stage 1. It's submitting electronic data to immunization registries, or the ongoing successful submission of immunization files to immunization registries or immunization information systems. In stage 1, this was a menu set measure. It was one of the public health measures in which you could claim an exclusion, and there's still exclusions available. It's now just been moved into a core measure. Another difference is that with stage 1, you could perform just one test, and if it failed, you still met the measure. Now you have to keep striving for a successful test, and once achieved, you must continue with ongoing registry data submissions. There are exclusions available for this one, including any eligible professional that does not administer any immunizations or any immunizations to populations for which the data is collected. The eligible professional operates in an area in which there is no immunization registry or immunization information systems capable of accepting the standards set by the 2014 certification requirements. The eligible professional operates in an area where no immunization registry or information immunization system provides information timely on capability to receive it. So if you ask and they never respond in a timely manner during the report period, you can claim an exclusion. And finally, if the eligible professional operates in an area for which no immunization registry or immunization information systems is capable of accepting the file format required by the certified EHR technology at the start of the report period, or they're no longer enrolling or can enroll at that time additional providers. Okay? So the method in which to do so has not changed too much. You'll still use the immunization export file as you did with stage 1. There are some differences in how the information is now being tracked and what information they are expecting, and that's what we're going to go over right now. In the immunization tab, you'll notice that there are a few new tabs, or excuse me, fields rather, that have been added. Okay. In addition to the standard format of age of the patient, location of where the immunization, the vaccine was given, and the route. All this is standard from stage 1. Are some other fields. Some of this was covered in last week's webinar, including setting up the CVX and manufacturer code name information for your immunization orders and clinic setup, so it automatically pulls in and populates with the immunization order for your patient. Still have to enter the lot number and the lot expiration date, dosage, and volume. New fields that have been added have been, additional reactions, immunities, so this is evidence of immunity, vaccines for children status. You'll notice that for our Michigan providers, there are a set of specific responses that are accepted. In Texas, you have one additional vaccines for children status in addition to the national federal statuses that are listed at the top. Okay? Immunization refusal reason. So if you go to give the immunization and the patient or parent of child refuses it, you must document by adding the immunization to ClinicsMD and indicating the refusal reason. This is for Immunization Registries tracking this information, and the date it was refused. Parental name is still included. If there's a contraindication present for giving the vaccination, you still must add this to the patient's order history by adding it here and then indicating the contraindication. Okay, and then, of course, the date. You'll notice there's this new checkbox that's been added, which is the vaccine information sheet. We've got that data set up in ClinicsMD based on the CVX code, aka immunization code provided by the CDC. And those CVX codes are mapped to specific vaccine information sheets in the CDC's data. Okay? So once you select the correct CVX code, immunization code, based on the vaccine by brand you're giving in your office, the appropriate vaccine information details will be available. Select that VIS checkbox, and the VIS info is both displayed and then included in the file that is generated. You can click the VIS details, and if for some reason you need to modify the date it was provided, you can do so here in this field. By default, the current VIS sheet information is selected. If you are documenting historically given vaccines, those that were provided outside of your practice, mark the pre-existing checkbox. The manufacturer code name then defaults to unknown, and it goes from being displayed as a new immunization to historical record. Okay? If you have multiple vaccines that you're given, this is especially relevant for your pediatric offices. You'll notice that there's a new Copy VFC status button that's been added, and it will copy the vaccines for children status selected for that first vaccine order, and then apply it to all of the vaccines selected. Final column that has been added is this publicity feature. Not all states are requiring this, and this call is going to be very general today because, as you can imagine, there's 50 different states. Most of them have their own immunization or immunization information system set up. Most are set up to accept the 251 files that are a requirement of Stage 2. Others are not, and when that's the case, we've written a program to downward convert the files. And not every immunization requires the same information to be documented. So this is going to have to be worked out on a case-by-case basis based on the state that you're in. some of them want you to indicate the publicity code in which you want to remind the patient or the provider to have future immunizations given. Okay, by default, we set it to no reminder, no recall. Here are the applicable statuses available. If you select a specific publicity status, you can then click the Copy Publicity button, and it will set it for all the vaccines. And then finally, of course, is the Complete All button. Okay. I wanted to draw your attention to a couple of additional fields that were entered in patient information to accommodate this new requirement. These were gone over last week, but I'll touch on them briefly here. The fields are multiple birth order, or excuse me, multiple births, an indicator, yes or no. If it's multiple birth, indicate the order, 1, 2, 3, 4, etc. Immunization protection indicator, meaning either the patient's information, their vaccine history can be shared with other providers or it cannot be shared. And the patient's immunization registry status, active, inactive, moving out of the area, etc. And then the address type for the patient. Okay. The third step is actually running the report, which is located still under our Reports menu. Select the Immunization Export Report. You'll set your date range. Select the file path. This is where that actual file is going to be stored on your computer. And then there's some additional information that you see here. And again, the specifics for this are different for each and every registry and immunization information system out there. Okay? So it's going to be a state-by-state cases on what they require. For example, in Michigan, they require the state facility ID, which would be entered here. And they also require that you enter the receiving application name, which would be MICR, M-I-C-R. Okay? That's specific to that state. Other states, such as California, has regional registries set up based on the provider's location. They would need to include the facility name, receiving application name, as well as the facility name. Okay? So again, this is just a very general review over what's required, and we'll have to go over on a case-by-case basis of what your state requires, since it's not consistent. And reading the specs that they've provided, it's like reading Greek. And then finally, click the Generate Export File. Okay. Based on the date range selected, any of the files or that are applicable will be included in that file and generated, and you'll get a pop-up telling you that the file has been made available. And again, from there, it depends on the state and their process for getting them the immunization files. Some states want you to upload it to a specific file registry using an FTP, a secure FTP format, such as Easy Move It. Other states let you do a simple upload process to their immunization registry site. Others have you go through this specific onboarding and testing process and connect through a health information exchange. In order to connect to a health information exchange, you have to go through that exchange's process. Sometimes it's submitting 5 records, sometimes it's 10. They'll test those and then get back to you. And then from then on, you'd be sending the files to the health information exchange rather than directly to the immunization registry. So again, we're going to have to tackle this on a state-by-state basis. I've provided my name and email address in the registry, but again, anybody can send me questions and I'll help you out directly. Okay? And finally, the last core measure is sending secure electronic messaging from ClinicsMD to the patient portal and from the patient portal back to ClinicsMD. This measure is relatively low. It's just tracking that you sent secure messages to the patient portal for more than 5% of your unique patients. Okay? To do so, you would go to your messages, and then select that you want to send a patient message. Click the New button to compose a brand new message. Indicate if you want to include the patient's name or specific patient encounter information. And then compose your message. And click Send. And that sends it to the patient portal automatically. You can also meet this message by responding to messages from the patient portal from your patient. For example, there was one sent today from patient Jackson Test from the patient portal to Dr. Alexander. Okay? So he can meet this measure by also responding to those received from the portal by clicking the reply button. And then click Send. Okay? Patients would then receive it in their messages box in the Clinics Vault patient portal, and they will also receive an email indicating that they have a new message. Moving on to the menu set measures. This is a bit different for stage 2, in which you must pick 3 out of the 5 available in ClinicsMD. Okay? Exclusions no longer qualify for meeting a measure. So you must select at least 3 that you can meet using your certified EHR technology. This first one is no different than stage 1. It's sending syndromic surveillance data submission. Exclusions for that is any eligible professionals not in the category of providers that collect ambulatory syndromic surveillance data on their patients during the report period. Eligible professionals that operate in an area for which there's no public health agency capable of receiving these electronic files. Eligible professionals that operate in an area where there's no public health agency providing information to you to receive the syndromic data. Or finally, 4, the eligible professional operates in an area for which no public health agency is capable of accepting the specific state that is capable of accepting the format, is not enrolling additional eligible professionals at this time. So those are the exclusions available for that measure. Okay? If that is one of the measures you're going to select, you would generate the report just like you did in stage 1. In the reports menu, there's a 2-step process. There is setting up the syndromic setup, the syndromic report that you want to track, and it's all done by specific ICD codes, so your health agencies that are tracking specific diagnostic information in patients with certain diseases. Okay? Just click Add, name it, and put in the specific diagnosis codes that are applicable. Just manually enter them in one at a time. Okay? Next step, once you've set that up, is selecting the syndromic export. It's going to look very similar to the immunization export. Select your file path. This is where on your computer you want to save this file. Set your date range. And it can either be pulled by either diagnosis onset date or your encounter date. And then select those syndromic reports you just set up. You can then add additional ICD codes to your report on demand if needed. Okay? And then click Generate Export File. Depending on the state public health agency, how they accept the Syndromic surveillance file is different, very much like Immunization Registry. So you'll have to go through the state's requirements to get them this file. Sometimes it's a file upload. Sometimes they want you to move it to an FTP site. Okay? Again, this is a bit more involved than Stage 1 in that you must do ongoing submissions of electronic syndromic surveillance data to public health agencies. Stage 1, you could submit just a test file, and even if it failed, you met the measure. Now, if you fail, you have to continue testing. Once you get to the successful test, you must then submit successful ongoing files to the registry. Okay? Second menu set measure is recording electronic notes. Progress notes in ClinicsMD are automatically generated. There's not an additional step that you have to do in order to generate the progress note. Okay? As you document information in the chart, such as medical history, vitals, medications, medication allergies, moving on to prescriptions, diagnosis, your chief complaint, etc., as you go through and enter that information, the progress note is automatically generated. Okay, so there's not an additional step that you have to do to meet that measure. Even at minimum, you're putting in information such as, the problem list, the vital signs, etc. That's automatically going to generate that note. There's no specific set requirements that define what an electronic note looks like. There's no minimum number of elements that must be included in the electronic note. It just is the electronic progress note. So your documentation in the chart is what generates it. Okay? The threshold for this measure is generating progress notes for at least 30% of your unique patients with at least one office visit during the report period. It can contain drawings. It can contain other content such as cutting and pasting of dictation or doing dictation straight into ClinicsMD with Dragon. As long as it's incorporated into this note here, and of course, like I said, as soon as you enter other information, it's pulled in and generated, you'll need this measure. So you're going to be 100% on this measure no matter what, even if you only see one patient in the report period, because it's automatically generated. It does mention that the text must be searchable in the progress notes. You'll notice here that there's this new Find button that's been added. Click that and you can search for specific text. And it'll jump to and highlight the text. Okay? So if you need to quickly search for a specific word or words, even matching case, you can do so using that Find button. That Find button is also available in the complete chart. So if you're going through the patient's progress notes or even filtering by specific visit type, if you need to find specific information within the encounter selected, you can do so using the Find button. Okay? Moving on, having imaging results accessible in the EHR for your radiology orders. The threshold for this is making sure that images are available for more than 10% of all test results test results which are images and are ordered by the eligible professional in the report period. I went over this last week during our Meaningful Use Setup webinar. Bring this back over here. In the order setup, in clinic setup for your radiology orders, you can indicate which radiology orders you can expect to have images in ClinicsMD associated with that. Our report then limits the denominator to only those radiology orders in which you've indicated can have a result associated with it. Okay, so again, it's imperative that you come into your orders list in Clinic Setup and indicate which radiology orders have imaging associated with it. Okay, that's the first part of that. There's two ways that you can accommodate this to achieve this measure once you have the images available. Either scan them or import them into the Images tab like you normally would, and then link them to the specific order. You can then view the image by clicking View. Okay. Or you can add it directly, scan them in, import them in directly into the Radiology tab. This was a new feature that we added in our most recent 9.0 update, the certified version we released in July. To add radiology images directly into the Radiology tab, click the Add button, select the category, and then either scan or import the image. Okay? It'll then update that you have one image associated with it, and it's automatically been linked. And this one would then be inserted into the denominator and numerator for this measure. Okay? Briefly, another feature that was added in our most recent result to help meet that measure is better using the pending orders list. For example, for this patient here, the uncompleted orders are in a closed encounter. Previously, in the past, you could indicate that the order was complete, and then you'd have to store the results in a future encounter. We've added the ability to actually add the results in a closed encounter. So you would select the Complete Order button, as you normally would, and then you'll have the option to either complete the order only, store the results in a new encounter, or add results to the closed encounter. Okay, you'll be automatically directed to the Radiology tab where that encounter is in the closed encounter. Okay, you'll notice that a new button was added here called Add Results. Click that, and it puts the tab in edit mode, and only the tab. You can then go ahead and add the images and complete the result. Okay? Oop. And then indicate that it was complete. Okay? And again, the encounter is still enclosed. It just put the tab itself into edit mode. Finally, recording medical history for one first-degree relative. And a first-degree relative is a mother, a father, a sibling, or a child. Again, last week during the setup webinar, I went over how to set up your medical history and to record the associated SNOMED codes to indicate your first-degree relatives under the family history section, and then how to set up the LOINC codes for the corresponding problems. Okay. To add it in the encounter, select Family History, select your first-degree relative, select the problem, and then close. Okay? tracking the family history with a first-degree family member is how you meet this measure in ClinicsMD. And it's for more than 20% of all unique patients seen during the report period. And the final measure is not, they didn't have any specific criteria, certification criteria. It's left open. It's very vague. It's reporting specific cases to specialized registry other than cancer registries, immunization registries, and syndromic surveillance data agencies. So this will be taken on a case-by-case basis. You just come to ClinicsMD with the requirements of what you need. We can work out pulling the data for you and setting up a way to interface and get that data to a specialized registry. And again, absolutely no specific requirements were included in that and as to what the specialized reporting looks like, what information they need, the file format they need, et cetera. Okay, so that'll be taken on a case-by-case basis as needed. So that concludes our core and menu set measures today that are a requirement of Stage 2. And again, after this session, I'll be sending out links to how to conduct a security risk assessment, both the tool and an FAQ published by CMS, and also information on the EHR randomizer tool to help you meet the third measure in the summary of care objective. Okay? If you have any questions, there's a question feature built into the webinar. Go ahead and enter them now. And I can answer them on a case-by-case basis. I'll leave that open for a few minutes. And if there's no questions, this will conclude the webinar today. We'll be covering the same information on Thursday's session, which is from 2 to 4 Central, with the same question and answer session. And then we will be publishing today's webinar under the Help menu in ClinicsMD in the training links. Okay? Okay, it looks like so far we've only had one question asked, and that is from Cynthia. And her question is, what happens if you don't meet one of the requirements? Each measure, each core measure and menu set measure have exclusions built into them. If you qualify for one of those exclusions, then you'll be able to meet meaningful use by claiming that exclusion just like you would have done during Stage 1 during your attestation process. So there are exclusions built in. If there are no exclusions built in and you don't meet one of the core criteria, or you don't meet the minimum threshold on it, so you are tracking it but you're below the threshold, then you will not successfully be able to attest for meaningful use for 2014. So you have to meet all core criteria that we went over, or qualify for an exclusion, and select 3 of the 5 menu set measures. And you have to successfully attest to 3 of them. You can't qualify for an exclusion for the menu set measures and qualify for meeting one of them like you could have in Stage 1. You have to have successfully reported on 3 of the menu set measures. If you do not, you will not be able to successfully attest. Okay? Next question is coming in from Anne. If a patient declines a clinical summary, did you say that by declining they will be included in the 50% requirement? Yes, that is correct. By indicating that the patient declines the summary, you will qualify for that measure. That patient will be inserted into the numerator. I don't have any more questions at this time to answer. It's a relatively quiet crowd. Again, just to recap, this information, this live webinar will be available under the training menu link in the near future once it's gone through some editing. And I want to point out that we do have all the documentation that was provided for all the Stage 2 measures available under the Help menu in ClinicsMD. There's the checklist that we provided, which gives you the list of core and menu set criteria, in addition to the clinical quality measures, with links to each measure, the specifications, so that you can review them and also review the applicable exclusions. We've also created a series of guides for you that you can download, including the Stage 2 Auto Measures Guide, information on the 2014 clinical quality measures, and then the setup guide, which last week's webinar covered. Okay? So at this time, I'm going to go ahead and wrap up today's session. Thank you all so much for participating. If you have any questions that you think of afterwards, please do not hesitate to send me an email. I can be reached at mary.brunson@clinicsmd.com. Okay? Thank you again so much for participating, and I hope you're able to join us for the next week's session that's starting to cover the clinical quality measures. Have a great day.